More than 1 million Americans are reported to be living with psoriatic arthritis. Here to tell us what it is and how we're raising awareness is Dr. Madeline Feldman and patient Christine T. Good morning to you both.
Good morning, Alex. Thanks for having us.
Good morning, Alex.
Of course, it's great to have you on. So, Doctor, I sort of want to start from the medical aspect of things. For folks who may not know what psoriatic arthritis is, can you give us a brief overview of it?
Sure. Psoriatic arthritis, as evidenced by the name, is a form of arthritis that can be associated with psoriasis. It actually belongs to a group of arthritides known as inflammatory arthritis. It's different from the wear and tear aging arthritis that everybody gets a little bit as they get older. This actually is your immune system that gets turned on somehow and doesn't turn off. And the chemicals released by your immune system cause pain, swelling, redness, and ultimately destruction in the joints. But it can also cause overwhelming fatigue and a lot of stiffness in the morning. And I think that differentiates it from just garden variety arthritis. You wake up in the morning and stiffness can sometimes last all day, at least an hour. Something else unique to psoriatic arthritis are what's known as nail pitting. It's like someone took a safety pin and dotted your fingernails with little dents. That also you can have Achilles tendonitis. Psoriatic arthritis has a lot of ligament and tendon issues. So oftentimes these things are just sort of ignored as part of getting older. Maybe you overworked a little bit too much. Life is stressful. Of course, I don't sleep well, so I'm going to be tired. People can always think of a reason how they can explain some of these symptoms. But I think if you get in and you see the right physician and it gets diagnosed early, I know for a fact treatment can prevent some of the downstream problems that can occur and the joint destruction that can occur with psoriatic arthritis. So helping create awareness for this is great, and thank you for helping us do that.
Well, of course, and that's a great summary of what it is for those who may not have known. So, Christine, you know, from your point of view, you've had to deal with this. How has it affected your life, and sort of how has treatment helped you?
Well, when I was first diagnosed 9 years ago, it was challenging physically and emotionally. One day I was unable to get up. I was unable to wake up. It took me 1 hour to get out of bed. It was very challenging to get ready to go to work, getting dressed and brushing my teeth. Also, just walking to the corner store was very exhausting. As well, I noticed a change in my fingernails. This led me to seek help, to go see a rheumatologist who, with my rheumatologist, we put together a treatment plan that works for me and it helps me. On the emotional aspect of it is I look normal and healthy on the outside, but inside I was in a lot of pain and I was constantly exhausted, and explaining that to my family was a real challenge. How PSA has affected me is for the positive, Alex. I've decided to take swimming lessons after my diagnosis. I said, I'm not going to let this chronic disease take over me. I am going to make my life better and live my life to the fullest. And swimming is a great form of exercise for me. It keeps me in shape. It helps me control my psoriatic arthritis. And it keeps me fit mentally as well.
Right. That's great. I can't imagine the toll that it took on you, but it's so good to see you healthy and sort of back to living your life to the fullest again. So, Doctor, if people want to get involved and learn a little bit more about psoriatic arthritis, where can they go?
We have a great website, gopsaday.com, GOPSADAY.com. On it, you'll see a number of the factors that I talked about in terms of symptoms that might help guide you to the correct physician, resource links to questions to ask your physician, or if you've been diagnosed, how to put together the best treatment plan. There's also social media badges that you can put up on your social media to help create more awareness among your family and friends. Talk about it with your family and friends, because so many people have never heard of psoriatic arthritis. So I think once you hear about it, once you understand the symptoms and understand the breadth of the prevalence, I think it will help people get to the right physician, get on the right treatment. GoPSAday.com.
Very good. It's very important to know all of this, Doctor. Thank you so much for the information, and Christine, for sharing your personal story about it.
Thank you, Alex.
Thank you, Alex.
All right. Now you guys stay right where you are. Morning Blend's going to be right back.